Hi, everybody. It is Thursday, November 19th. We are 1 week away from Thanksgiving, and we want to highlight some of the numbers coming out of Arizona as we talk about coronavirus, as we do each and every day. Our goal and our objective here today is to help you understand the numbers in Arizona so that you can make the best decisions for your family and your life, and specifically, in this case, the upcoming holiday that we just highlighted there. But boy, today's numbers shocked a lot of Arizonans who have checked the numbers already. AZDHS reporting 4,123 new cases of coronavirus here in Arizona, and also our school board, our school district's mapping came out again today. It had a whole lot of red. That means a big substantial category. We're going to go through all of that today and talk about some of the other things happening here in our state that are some big changes for families during this pandemic. So Garrett, we start where we always do. I want to welcome you in, and I see people are already putting their zip codes in, so we'll have plenty of time to get to that as well. I also want to tell you the White House COVID task force is holding a briefing right now. We're monitoring that in the newsroom for you. You can see the screen up behind me actually there. We'll continue to watch it for you, and we'll keep you updated on everything that comes out of that as well. So Garrett, we'll start where we always do, on that AZDHS page with the most recent numbers.
Yes, as you said, Katie, we have 4,123 cases added today. This is the fifth highest daily reported numbers that the state has ever had since the beginning of the pandemic. So all of the other highs that we are looking at all occurred in early July. That's when the reported highs were. And now we are the fifth highest at this point. So we are increasing. There's really no other way to put it. We have 18,000 tests that were reported today. This is also putting us above our July peak for testing now. This is the first day in about 2 months that the diagnostic percent positive, the cumulative percent positive, has increased by 1/10 of a point, or at least done any sort of increase. The movement in this metric has always been going down. Ever since really July, it was going down. This is the first time that it has gone up again. So that's it. But it's a very small movement, but still, that's showing you that of all these tests, these 18,000 tests, 19,000 tests that we're putting in a day on this system, they're coming back above 10% positive.
So this number is affected by the length of the pandemic, if I'm understanding you correctly, Garrett. So we could only see a little bit of movement because it's reflected way back since February or March.
Very beginning. So all 2 million tests are reflected in this number. So it's been 10.1 for several weeks now, and then it was 10.2 prior to that. It only moves in about a 10th increment every single time it's updated. And today was the first day that it just visually rounded up to 10.2. And that's the first time in quite some time that this metric has gone up rather than down. And again, that's an indication that our testing is now coming back above 10%. And we have seen that for several days now. About the rest of this whole week essentially has been above 10%. We're seeing 12%, 11%, 10%, but essentially it's been double digits for the entire week on the tests that are coming back right now.
Okay, so, and as we always do, just to highlight Maricopa County, to give a little more perspective, we do so because Maricopa County is our most populous county with 4.4 million Arizonans living here. And it also had the bulk of the deaths as well. 13 deaths, I believe, reported in today of the 19 across Arizona, if I'm not mistaken.
Mm-hmm. Yes, that is correct. So, and it's about 2,500 of the 4,100 reports. Case reports, that's what we would expect from that particular number. And like you said, 13 of the 19 deaths. We do typically see that Maricopa County does take the lion's share of the deaths sort of over what its population statistics are. That likely has a lot to do with many of the long-term care facilities and congregate settings in some other places would be attributed to be in Maricopa County, as well as the hospital systems in Maricopa County and whatnot. But this is where we are with Maricopa County. You can see their diagnostic percent positive is just on the whole about a point higher than it is for the rest of the state. When you take that out, the cumulative is 10.2, and for Maricopa County, it's 11.2. That's balanced off by Pima's lower percent positivity at 7.8, And that's one of the reasons why Maricopa County can have a higher cumulative percent positive and still the state number be under what Maricopa's is, even though Maricopa is the lion's share of the population.
So, and herein lies the larger concern in all of this. I see some people in the comments saying, well, they might be asymptomatic. It is true that most people, in certain categories recover, but we know, based on looking at the history of this pandemic and the numbers here in Maricopa County, that anywhere between 8 and 11%, and I believe today it's at 8%, end up hospitalized. So when you see this case number coming in each day of 4,000 people, if it's between 8 and 11%, we'll just use 10% for easy math on it. You could figure that about 400 people are going to end up being hospitalized out of this group. And that's the concern for our healthcare workers. That's why $25 million went to support their services yesterday from the governor's briefing that was held. It's a big concern how our hospitals are going to be dealing with this.
Yeah, and just to show you sort of what these look like on a weekly basis, I put this into a week because it's a little harder or a little easier to read this way. And you can sort of see how the trajectory of our increase here has been a little slower than our initial pandemic increase, this surge. But essentially it is on track. It's only slightly slower than when our first surge. And you're seeing right now, for example, now that we're about 4 weeks into the surge, 5 weeks into the surge, we're at 17,965 cases for the week of November 8th to the 14th. And that would sort of mirror this number, which was June 14th of 20,000. So this number can still increase, by the way. As you can see, this number right here is extremely low because only 2,700 cases have been added to this week. There's still a lot of reporting to be done. There's only 2 days of this week there's only 2 days in the system for this week of November 15th. So the majority are still being added to this. So this number still could increase and surpass this 20,000. As you can see, if you look at it here, this one was, this June 7th was 12,600. And this one was 15.2. So it did, if you look at the two hills, that second one is substantially higher than that one. So if we're sort of looking at the patterns between the two, it does appear that this one, there's still a lot of room for growth here. It could still surpass that 20,000. And we could be looking at, in the next 2-3 weeks, being at a peak, at least for now. We don't know where that peak is going to end, of course, but we will surpass our early July, late June peak of 27,778 cases in a week.
So really, Garrett, this chart is also about how fast these test results are coming back, because it is plugged in based on collection date. So it doesn't matter if you went to a rapid 30-minute test over a CVS, or you went to the ASU saliva test, maybe heard back within 24 or 48 hours, or went somewhere else, and it took 3 or 4 days to get an answer, which is nothing even to complain about after what we experienced this summer. Some people waiting 2 weeks to hear their results.
Yeah, I mean, that is the sort of silver lining. Again, it's hard to find silver linings in these things, but the silver lining in as far as tracking this for everybody, not just the media, but for the people who are actually making the decisions as well, is that we get this information a lot faster now. Our lag time for these case positives being added is pretty much 4 to 6 days. 4 days is not a lag at all, because it takes at least 4 days for it to be put into the system, and at most the lag is 6 days right now. When we were back in that beginning of July, if anybody recalled, that's kind of when we started doing this this daily report, you and I, and we were at 23-day lags, 15-day lags, 60. It was just the lags were 2, 3, 4 weeks, and so we didn't know where we were in the pandemic until about 3, 4 weeks afterwards. And it's like, oh, it looks like we're going down, but we couldn't find out we were going down until sometime in late August.
Yeah.
Now this time, with these only 6-day lags, the good thing is we should be able to see where we are in this pandemic only about 14 days, anywhere from 7 to 14 days after it happened. So that just makes it a little easier to say, look, we are at least, we don't know how long the downturn is going to last, but we're on a downturn. We're not on a downturn right now, by the way. In the future, we could be on a downturn, and we'll be able to detect it a lot faster than we did in the summertime.
Yeah, hopefully a downturn sooner rather than later. I want to update everybody, as we've been listening into the task force briefing that happened. Dr. Burks talked just a little bit earlier, and Garrett, this is kind of interesting. She was not calling it the first surge and second surge anymore, but simply calling it the spring surge, the summer surge, and now in the fall surge, which I thought was so interesting because when we look at our chart here in Arizona, and it just speaks to how the experience has been different across our country and how fast this thing showed up, we really then, looking back, Arizona kind of missed the spring surge, if you will. Our summer surge was overwhelming, and now here we are in this fall surge. But it was the first time I heard someone speak of it like that instead of first, second, third surge.
Exactly.
And she also, go ahead.
No, you continue your thoughts.
She also highlighted the trajectory of those surges and sort of how those slants looked and how this one is really shooting up, and that's why it's so concerning, and that we absolutely take action right now. And again, highlighting the mask wearing and keeping your distance and washing your hands and all the things that we all know so well now, but that we really have to double down on our efforts to get that curve back down again. But to call it spring, summer, and fall, I just thought was interesting because we missed it.
This is what they're talking about. So I'm looking at the 91-dboc.com. This is a great place to go and look at the sort of per capita rates of all of the states. In fact, you could also look at countries, but this is exactly what you're talking about. This is the spring surge that they're talking about, the winter spring surge. And this is the one where New York was at the top. And then we have the summer surge, which belonged to Arizona, and the Sun Belt. This was definitely a Sun Belt surge. If you look at these, Florida is the next one here. The next one is Louisiana. A lot of Sun Belt states in this section. And then we get over to this surge. You can see much, much higher rates in this surge. And a lot of them are Midwestern states. States that in the winter, they really close up because the temperature outside is just, it's freezing out there. So you've got North Dakota at per capita rates that at one point we were the highest. I mean, look at this. This is incredible compared to where we were at the time. South Dakota, Wyoming, Iowa, Nebraska, Wisconsin, Minnesota, Montana, and then you start getting, so those are all the Midwestern states, and then you start getting into a little farther away from the Midwest. You still have Utah, you do have Illinois in here, Indiana, Colorado, and then we start getting into where we are. Believe it or not, even with our numbers, at least per capita wise across the country, we're actually in sort of the bottom tier at this point as far as case numbers going up right now.
Yeah, it's a real reminder to act now. And as we see these numbers in South Dakota and North Dakota, it's something I watch closely, being my home states there. And it's devastating to see family members who are fighting this thing right now. So it is no fun, to be sure. Okay, I want to update you on some breaking news that's just coming in out of California. So I know a lot of families still were making decisions about Thanksgiving and possibly traveling to California. Due to the rise in the COVID cases there, California is going to issue a limited stay-at-home order. So non-essential work and gatherings must stop from 10 p.m. to 5 a.m., sort of like the curfews that we've seen in other areas for counties that are in the purple tier. It's going to take effect at 10 p.m. on Saturday night. So if you had plans to drive out there this weekend, you need to make note of this. It will remain in effect for 1 month, and the hope is that that California is able to flatten the curve. So wanted to update you on that developing and just breaking news that's coming into the newsroom. I want to get back to Arizona even more specifically. I know so many people are wanting to know about schools, and they were hoping to hear a little bit more from the governor yesterday about what to do and what to do when. That did not come, so it is up to each of the school districts to make decisions, as it has been, about staying open or closing. We had just heard of 4 major school districts that have shut down today, 71 schools in all. This is just for today. So 58,000 Arizona students and families are scrambling right now to sort of figure something out as their kids are being sent home. Last week, we saw the same sort of thing. This is exactly what Garrett and I gave you all a heads up to that could be coming, because, these numbers come out on Thursdays. So let's get to that right now, and we can sort of dive in. And I'm going to remind everybody, as I always do each and every Thursday, remember to look not only at your zip code, but at your school district, whether that's a high school district or elementary school district as well, because how those are broken up make the situation look a little bit different. Although, Garrett, it seems like everybody's just in the red now. So that's for number 6. So click all the way through to see the 2 weeks, the 2-week look back in that for everybody everybody who's looking at those closer. But important to look at all three of those places to really understand what's happening in your neighborhood right now. So Garrett, we'll get to that map. It comes out at 9 every morning. But boy, a dramatic difference from last week.
Absolutely. So yeah, let's just go right in, right? So I'm going to start with the cities map in Maricopa County. And Detriel, we've got some people asking for zip codes, and we will get to the zip codes in one moment. I just want to go from the largest jurisdictions to the smallest. So as you can see, really at this point, the only cities or towns that in Maricopa County that are not in the substantial category are Fountain Hills, Cave Creek, and Surprise, and then Wickenburg. And then there's I think this is Gila Bend. So aside from those jurisdictions, everywhere else has been moved to the substantial category in the city.
And Garrett, when you click on those, are any of those looking like next Thursday will be when they switch? Boy, yeah.
I would say with these Cave Creek, as you can see, Cave Creek may stay in the yellow next Thursday. Wickenburg will likely stay in the yellow next Thursday.
Shape in Wickenburg.
Gila Bend is very close, but it may stay. It really depends. But aside from that, Surprise looks like it's going to flip to red next week as well. And so is Fountain Hills.
And we'll work to find out, unless Garrett, correct me if you have heard since then, how things are going to look next Thursday when this map comes out. Do we expect it coming out of the county because it's a holiday on Thursday? We can work to find that answer for folks in the next week, but that's when those cities would change.
Yeah, they put something out on that. Let me see if I can find that really quick. They did have something on their dashboard that notated the guidance for Thanksgiving, and let me see if I can find that really quick.
And as you're looking that up, I'll give you just a second to do that. For those of you who missed us off the top, this is the 5th highest case count day that we have ever experienced here in Arizona, with more than 4,000 cases coming in, 4,123 cases reported overnight to get us to a pandemic total of 287,225. So a huge number of cases coming in, but we did have 19,000 tests reported back to us. Because this case count is so high, we are now once again in the number 4 spot for the highest number of cases per county in the United States. We have been as high as the 3rd spot, been a lot lower in recent weeks, but now we're back up in that 4th spot for that. Garrett, were you able to find an answer?
Yes, they said that the next week's map will be updated on Wednesday.
I was figuring that.
So it's going to go back to its old schedule for one day. It's going to be Wednesday, 5 p.m. That's when they're going to update it. And then after that, they'll go back to the Thursday at 9 a.m. Schedule that they've been following.
Okay.
So let's go to the next one, unified school districts. These unified school districts, 85% of these districts have moved up in their per capita rates. And so that would be, as you can see, all of these districts down here. The East Valley, there's large numbers of case increases in the East Valley. We have all of this entire sort of East Valley swath going up to North Phoenix have all been put into the substantial category, as well as Peoria, and then I believe Deer Valley as well. And most of these, like I said, 85% of these districts have seen increases. High school districts, all of the high school districts have seen per capita case increases, every single one. All of the high school districts are now in the substantial category. So
I mean, at this point, Garrett, the only thing that is keeping these for sure open, if they haven't made the decision to close, is that CLI. Where does the CLI sit right now? And we want to remind everybody, at 10%, that's when they're asking the schools to be closed, but it could be weeks before we hit that.
Yes, we're at 5% today. It's hit as high as 6% in the more recent data, the data for this week so far. So this looks like it could creep up to 6% next week, maybe even 7%. At that point, you know, if we get into a 10% situation, then that's when counties are put back into the substantial category across the board, and that's basically going to impact everything at that point.
Okay. Carrie's asking, will you guys be on next Wednesday? We will. We currently have plans to be on at 3 o'clock. We can see what we can do about moving this so that we can get you that information, because I don't believe, Garrett, that we have plans to be on Thursday. So let me see what we can do for you, Carrie, to help you guys out with those updated numbers next Wednesday as well. So we'll Garrett and I will come up with something. We're good like that. Even if it's just a quick 5-minute Facebook Live just to update you on that, we're here for you for that. So, okay. So, and with these elementary.
Yeah, this is the elementary schools. About 75% of these have seen per capita increases. And as you can see, a lot of that has to do with the fact that most of the elementary schools are in the urban areas, southeast Phoenix. You do have some elementary school districts that are still in the green, but these are districts that have very, very few people in them. As you can see, this one right here, Sentinel Elementary School District is still at 0 cases per 100. But of course, there's very few people in that district. So this one's 75%. And then when we go to zip codes, this is what it looks like. 90% of our zip codes have seen per capita increases this week.
Okay, so let's do it. Without further ado, you guys can type in some of your zip codes, and we'll let Garrett lend his expertise to what is changing there and for how much longer it might be sitting in the color it is, whether that be yellow or red.
Yeah, and, I mean, at this point you can see that really it's especially in the urban areas of Phoenix, these yellow moderate zip codes at this point are essentially holdovers and will likely flip next week. There's really no rhyme or reason to this right now. 85029. Again, almost all of these are going to be substantial, whoever puts these in. So this has increased from 117 to 158 with a 14% positivity on 85029. 85207. This is increased from 129 to a 200 case per 100, and that's with a 10% rate. 85233. 85233 is looks like it's a holdover. It still has yellow from last week, but it's already at 184.
I mean,
will likely go to red next week. 85374. 85374. This actually, this one, it's interesting. Up here in the Sun City area is sort of the only sort of area left in Maricopa County where the numbers haven't really skyrocketed. But you can see this one does have red for this week, but still a positivity rate of under 10%. So 85234. This is a Gilbert zip code, and this one went from 125 to 210 with an 8% positivity rate. 85310. 85310 went from a 104 to 207 with a 10% positivity rate. 85345. This is over here, Sun Valley area, 116 to 151. So not a huge jump for this zip code, but still it was in the red last week. So 85381. 85301 went from a 94 to a 192. So it was moderate. Now it's been flipped to substantial. So 85304, right next to it. Wow, 76 to a 125 with an 8% rate. And then 85122. I do not have 85122. 85015. 85015. This is downtown Phoenix, from a 97 to a 158 with a 9%, almost 10% positivity rate. 5207. 852. Oh, we already did that one. Let's see, 85331. 85331 up here. Looks like this is a holdover from last week still. It hasn't flipped yet, but it does have a case per 100 over 100 for this week, so it will likely flip next week. 85234 we already did. It did increase. 85015, I think we did that one as well. 852, oh, we've got a lot of 85234. I think it's the same person. So yeah, it's going up. So we already did 85282. 85282 went from a 119 to a 170 with a pretty low percent positivity rate, only a 6% there. Very interesting. 85044. This is 101 to a 187, and it's 7% positivity rate on this zip code. 85283. 85283 has gone from a 108 to a 154 with a 6% positivity rate, fairly low for when you compare it to the rest of the valley here. 85225, 155 to 264 with a 12% positivity rate. So this did go up pretty. This went up pretty substantially compared to last week. 85396. 85396 over in the West Valley. 108 to 366. This one is more than double.
Whoa.
Yeah.
366, Garrett. That has to be the highest we've seen.
This is the highest we've seen so far. 108 to 11.9.
Wow.
New rate with a 366. So that's really what's in the zip code. There's not really much in the zip code either. It does look like there might. It says a Buckeye military reservation and Verado, but that's all I can see that would.
Wow.
In that district, that's a very.
Yeah, we'll keep watching that for everybody. That is the highest one we've seen.
This is 85037 from a 195 to a 222 with a 14%. Actually, this one, believe it or not, seems to be pretty level. Slight increases in the zip code, but fairly level compared to what we've watched so far. 85209 from a 159 to a 193 increase, but not a substantial increase. 85142 Queen Creek. This one is now, I mean, look at this. At the other end of it, we were in the West Valley. Now we're in the far East Valley. From a 175 to a 291. So this one's nearly as high as that West Valley zip code that we just looked at with a 9% positivity rate.
I mean, I'm shocked. This is concerning in these spots.
This is Litchfield Park. It went from a 129 to a 214 with a 9% positivity rate. 85138. No results for 85138. 85209. Sorry, I should probably not put a plus there. Doesn't work like that. 85209. We may have seen this one already. 159 to 193 with an 8.4. 85383. 85383 is 118 to 296. So a little more than doubling in this one with a 30% positivity rate in this district, in this zip code. Let's see. 85021. 85021 went from a 68 to a 101. This is a yellow district right now, or zip code, but it will probably flip to red next week with a percent positivity of actually 5%. Very low positivity rate for that zip code. 5209. I think 029. Sorry. 85029. I should probably do that one right. Right next to it. Wow. 117 to 158 with a 14%.
14%.
Yeah.
And this is right in Deer Valley. Is that what I'm seeing right here?
Yes, this is Deer Valley. Yeah. Okay, I'll do 85234 one more time because I had a couple people. 125 to 210 with an 8% positivity rate. You know, that's a moderate increase from what we've been looking at. 85051. 131 to a 117 with a 15% positivity rate increase from last week. So 85374. 85374 is at 115 with a 7% positivity rate, slight increase from yellow to red, and this will probably flip next week. 85085, 175 with a 6% positivity rate. When all things considered, that's actually not too bad of a jump. You know, we're kind of comparing the zip codes to themselves here.
Yeah.
So this one, the same kind of boat we just talked about, 108 to a 154 with a low positivity rate increase. Fairly good compared to what we've seen from some of these other zip codes. 85007. This is a downtown district. 237 to 237. No change in their cases per 100, and a percent positivity at 9%. So 85225. 85225. I think we already saw this one. 155 to 264. So
for people that are asking outside of Maricopa County, this is a Maricopa County website, and producer Carrie's awesome enough to add that in the chat there for you if you want to drill down a little bit more to your specific school district or zip code. And also it's right there on the bottom of the screen for you, whichever is easiest to copy and get the information from.
We'll do like one or two more of these things. Sure. 177 to this one went from this is 85051. It went from 131 to 177 with a 16% positivity rate. And then 85205, this is what we'll finish at. And this one, oops, sorry about that. This one went from a 128 to a 208 with a almost a 10% positivity rate. So as you can see, a lot of them we looked at really high rates. We're seeing really high rates in places like, you know, we'll look at some of these, you know, these zip codes, like, for example, this one, 85009. We'll look at that one really quick. You know, this 150 to 160, but this has a very high case numbers. So it's actually not surprising that it's moving as slowly as it is. One of the interesting things about you're saying about these areas is this isn't a very populated zip code. This one seems to be the highest that we found, and it only had 108 last week, and that means that in just 1 week time, that 108, that number of people, 108 per capita rate, it more than tripled in that zip code. So now 3 times as many people have COVID-19 in 85396 this week than they had last week. So that's sort of the way you have to read this map when you look at it. Is sort of say, okay, this is how many people have it now, and when you see like a jump, for example, of this 113 to 195, that means that it's not an additional 195 per capita rate. It's there's a holdover from this last week, and this is what it looks like now. So basically, like 80 per capita. I know it's a per capita number, so it's hard to distinguish it by population, but that's the number of people that contracted the COVID-19 from that time period.
So Garrett, how delayed are these numbers that we're looking at here for people?
These numbers are actually not very delayed. So Maricopa County produces this map, and they keep it only a week behind. So this one should be from the numbers we're looking at now should end on November 14th. That's the last day that these are calculated, and the week prior is that other week. But really, they keep it even more current than the AZDHS data.
I mean, so if it ended on the 14th, it's the 19th, and we've seen these huge numbers, we're going to still continue to see jumps next week.
Yes, I mean, it does appear that we're going to continue to see jumps. Now, next week, of course, is going to be interesting as far as reporting is concerned, because realistically, Thursday and Friday and Saturday and Sunday, essentially, there'll be almost no reporting for that entire week. So what we need to brace ourselves for is, very low reporting numbers for that, because, Wednesday, I know Wednesday's not a holiday, but a lot of staff are going to take that Wednesday off over at the county health departments. And so their reporting is going to be a little lax on Wednesday. And then Thursday, Friday, Saturday, Sunday, there'll be almost no reporting. And so those Tuesday, Wednesday of that next week, we could have some really astronomical numbers being reported. And that's when we're going to have to distinguish between reported and actual data collection, because we'll probably have situations in which there's numbers being filled in, 6, 7, 8 days in the past, simply because of administrative reporting.
Right. Having to play catch up on all of that. Somebody's asking if I'm sick. I'm not sick. I would never be in the workplace and infecting people. I've just been tested. We all have just been tested in here. So as essential workers, it's our responsibility to make sure that we are all safe. So to answer that question, I'm feeling great, and I have a mask, and and we're in this too. We're in this with you. So thanks for your concern, though. Okay, so Garrett, really, when we're looking at things all across the U.S. and here in Arizona, we're seeing a sort of broader response in some of the bigger cities like New York and Chicago if they're shutting down schools. We just heard from New York schools yesterday that they were all shutting down. We're kind of doing ours a little more piecemeal. That's why we have to walk everybody through this. So I want to remind everybody, if you want to see the very latest list of school closures here in Arizona, go to abc15.com/schools, and it's got the whole list. So we had the list of schools that had messaged family members and parents about outbreaks, and that map has now been expanded, and it's got school closures. There are so many. My kids' school is closed until January. A lot of parents are going through the same thing right now, having to juggle working and the kids at home and everything else. So they are home, and you can find out if your neighborhood has shut down that school from that list. There it is right there on your screen, abc15.com/schools. It's an interactive map, some really good work put into that to keep it updated all the time. But as I mentioned, 4 major school districts also added to that list. That's 58,000 Arizona kids being sent home right now from this.
And just a reminder on that as well, when we're talking about this school dashboard, we look at these per capita numbers and these substantial transmission rates. Remember that we're looking at numbers in that entire jurisdiction. So that does not mean that when we look at a school district map that we're looking at what's going on in the schools.
Right.
We're just looking at what's going on within the boundaries of that particular school district. So in order to get those numbers, there's sort of a couple places you can go. In order to get like just the totals from Maricopa County, you can go to their dashboard, and it will show you what the actual school numbers are like. Right now, 58 schools are open. 19 are closed that have associated COVID-19 outbreaks. 374 cases in all have been discovered in the schools. 283 are students, 91 are staff. Now, Maricopa County does not tell us where these schools are. In order to get more information, you do have to go to one of the dashboards that are offered by the public school systems. I know that most of the East Valley has dashboards, and some of the Northwest Valley also have dashboards. I don't know all the dashboards offhand, but
a lot of the major school districts have, set those up.
We have some sort of reporting, even if it's an Excel spreadsheet with the name of the school and the number of COVID-19 cases, and they might even be only reporting on active cases, because since we're talking about a younger set of people, oftentimes the COVID-19 just kind of goes and, it doesn't. There's a good chance that with younger people, it doesn't impact them that strongly. So they'll only give active case numbers. And so it may fluctuate. You may see like 12 one day and then 8. And that means that it's not a cumulative number. They're basically only putting on their active infectious students on the dashboard. So that's just something to take into consideration when you're looking at these numbers.
So we always want to make sure that we have at least a little bit of good news for all of you as we have to highlight some really tough stuff in here and some really difficult numbers. There was a report that just came out within the last hour that greenhouse gases are at the lowest level they've been in 3 decades. Obviously, that's because of the steep drop in air and automobile travel. People are not driving their cars as much, driving to work, trying to work from home or school from home, not traveling to see friends and family. But the greenhouse gas is at the lowest level in 3 decades. And you know what? We'll take the win and the celebration where we can in all of this. The other big news, of course, is on the front for vaccines. And Moderna and Pfizer are the ones that we've been talking about so much, Garrett, between 94 and 95% effective, it seems, at least in the lab. Now they've got to send that out and see how effective it is among the general population once everything's rolled out. And then also these at-home kits. You've been hearing a lot more about them. The at-home kits, the rapid tests, they would be like 30-minute tests that you could do at home. So you could test, possibly go get in the shower to get ready to leave your home, and then have an answer before you leave so that you know that you're safe to do that. There's several companies coming out with that. Costco's selling one. LabCorp has one. They're between $130 and about $120. Walmart's going to have one soon. Some of these are where you mail back and some are where you test right. They're truly all inclusive at home. So on the front of getting a little closer, we're getting there. It's just taking some time. And in the meantime, of course, masking up, washing your hands, and staying socially distanced. All right, let's get to some of the questions. And Sarah was just asking a question about total active cases here in Arizona. That has become a more important topic as we see these cases rise, Garrett, especially because for a while, we weren't seeing as many cases. That number was sort of static, and now we're seeing that move quite a bit right now.
Yes, it's going up. Now, Sarah, I cannot fully answer your question because there is no active case number for the entire country. It does not exist. In fact, it barely exists for every single jurisdiction. If you look at things like covidtracking.com, which does try to give a recovery, if you really look from state to state on how they're defining that recovery number, it really varies very wildly on what they consider, what each state considers a recovery. So I do not have anything that I would say is a trustworthy source of what is recovery. For example, Arizona, if you look at one of the, either COVID tracking or worldmeters.com, I think is the other one, and you look at our recovery number, it's extremely low in Arizona, and that's because they're only using our hospital discharge rate, which is only 40,000. So that basically is saying of the 250 or so thousand, 287,000 people in Arizona, only 40,000 people have recovered, and that's absurd. There's been a lot more recoveries in Arizona than 250,000 recoveries. Now, what I can best estimate is instead of recoveries, we can estimate active cases. And what we have there is we have anywhere from 34 to 55,000 active cases that are confirmed cases in Arizona at this time. Now, when you look at we were talking about Maricopa's Sero survey yesterday, they also estimate that the number that we're not catching is about 4 times higher than our active case numbers. Yeah. That essentially means that if there's 55,000 people walking around Arizona that are active and confirmed, then Maricopa County does believe that that number is closer to 200,000 across the state that are active and are active and infectious.
Yeah, so and I think that helps answer Sarah's question right there. And the serosurvey, for folks who are unfamiliar with it, was a statistically they sent these tests out, and they sent them to neighborhoods where they had enough of a sample to reasonably say they could sort of forecast out how it looks here in Arizona. And they were saying 1 in 10 in Maricopa County have had COVID-19.
Yeah. And they did that, as you said, a statistically valid sample. So they made sure that they weren't looking for people who they knew already had it. So they weren't going to hospitals and saying, hey, you know,
everyone here test. Yeah.
Will you take an antibody test? Like, well, yeah, I will take an antibody test, but of course I'm going to have antibodies very likely. So what they did was, like you said, they went out, they put together a zip code, sort of a neighborhood map of where they thought were the most statistically representative areas in Maricopa County. And then they went to those areas, canvassed those neighborhoods, and asked people in those neighborhoods to take this test. And I don't remember the exact number, but they did get to a statistically valid sample. And that's when they determined about 10% of Arizona has had antibodies to this.
So, and that brings up a bigger point just coming out of that news conference, that COVID task force conference, and they were talking about this asymptomatic group being so concerning right now, and specifically the asymptomatic group that's under 35 years old. So they're presenting as healthy, they look healthy, they go to see friends and family. Because you're around your family over Thanksgiving, you let your guard down, and then that under 35 age group that's also asymptomatic is the one that's becoming the super spreader, accidentally or without getting tested to find out. So they're really stressing that group go get tested, especially before Thanksgiving, especially before the possibility of seeing anybody outside their home. And then the other thing they talked about, which really points to that map that you showed a little bit earlier, Garrett, is that the Midwest had that cold snap, that early season cold snap in September. Remember, we saw so many areas with snow early in the year, earlier than they normally do, and that forced so many people indoors and caused a super spreader event that we're seeing those numbers reflected in South Dakota, North Dakota, Iowa, Minnesota, places like that. While we highlight those states, the top 5 states right now that are growing at a rapid rate: Texas, California, Illinois, Wisconsin, and Florida. So it's pretty in line with the states that we're seeing take some mitigation steps at this point in the game to try to slow the spread in all of this. All right, we are so quickly running out of time. I'm sorry we didn't get to more questions. Thursday is always a busy day for us. Garrett, what things are you going to be watching as we head into tomorrow?
Tomorrow, I want to look to see what the case number is going to be, obviously, tomorrow, to see what the trajectory of this is, if we are continuing on this path, or if maybe we're slowing down a little bit. The death number is becoming increasingly important. The two numbers that are becoming increasingly important are the death number that's reported, obviously, because that's such an important metric. We want to make sure that, you know, we need to know how deadly this thing is, if it's less deadly or more deadly than it was in the summertime. And then also the hospitalizations. They're starting to creep up again. We've talked about that. They are increasing at the same rates they did back in June and July. And it's causing stress in the hospitals at this point, and it's starting to worry medical professionals, because it does take a lot more resources to deal with a COVID-19 patient than any other. So while we do have 90%, only 10, 11% headroom, the majority of cases are still from non-COVID-19, but as that gets up to 50%, they start having staff issues in the hospitals, and they're getting nervous. They're just getting nervous is what it is. We have to keep watching that.
I don't blame them. It's incredible work that they do, and to see all of that coming after just being in a stressful time over the summer, I can imagine physically and mentally you're just recovering from that surge, and now seeing this on the horizon again has got to be a lot. So thank you to any of the healthcare workers who are on here right now, and all of them that are out there on the front lines working hard to protect us. We had 170,000 U.S. cases overnight, 170,000, and 1,848 American deaths from this just reported in the last 24 hours. So it shows that they're experiencing this all across the country. All right, as we leave you this afternoon, I want to let you know where you can go to get a COVID-19 test. So many people, Garrett, I feel like we talk about this all the time, but I've had several friends just reach out within the past couple days, and family, asking where they can go get a test. So the easiest place is to go, and thank you, producer Carrie, for adding this in the bottom of the screen, the AZDHS site, or you can go to doineedacovid19test.com. On that AZDHS site, site, scroll down about halfway through, and it's got the section there that shows the saliva test and then the regular nasal swab. You can sign up to get a test. Even if you don't feel sick, you can go get that test. They should be free of charge everywhere you go, so you should not be paying for this test. This is something that is covered. I prefer the saliva test. It's easiest. Did you do the saliva test at all?
No, I got the other one that was just absolutely not fun.
You're braver than me. I think the saliva test is
I
so easy.
would have taken the saliva test, but that's the one. They're like, nope, you're doing the PCR. I was like,
Oh,
yay.
Oh, they
Yeah,
told
it
you
was
that
as
too.
miserable as you would imagine. Yes.
Oh, well, I'm hoping that I can still stick to the saliva test. I feel
Yeah.
they're a lot more easier and quick. So all that information is on the AZDHS site. Just scroll down to the center there and get signed up. So people were asking me too where you find the agency code for ASU's test, and that is right there on that page as well. So be sure to copy it before you head into the portal to sign up. All right, we are out of time. No more time left, Garrett. I want to let everybody know where to reach you on Twitter at Garrett_Archer. I'm on Twitter at Katie Rammel. You can find me on Facebook as well if that is where you prefer, facebook.com/news from Katie. We have newscasts and all our latest reporting on coronavirus coming up this afternoon at 4, 5, 6, 9, and 10 p.m. And you can find it at abc15.com/coronavirus. Remember that school's dashboard is over there too to find out about closures in your neighborhood. Thanks for all the thank yous coming in. Vicki saying thank you so much for your hard work, and Kristen saying thanks you guys. And Brant too. Thanks ABC 15 team. Thanks you guys. We appreciate it. Stay masked. Stay safe.